Welcome to today's episode of Navigating Nursing School with your nursing tutor. Today is a special episode because I am going to tutor you on heart failure. I'm going to teach you everything you need to know about heart failure, and I'm going to do it using the Silver Bullet study system so you can see for yourself how much easier it is for you to understand the symptoms and the nursing care when you use my 4-step method to study versus the way you're currently studying, where you're just feeling overwhelmed, trying to memorize all of these symptoms. They sound like they overlap with every other disease process you're studying, and you still can't pick the priority nursing intervention. So let's get started today. I am Nicole. I am a professional nursing tutor with over 15 years experience, and I am the founder of yournursingtutor.com, where I provide group tutoring memberships, one-on-one tutoring, and pre-nursing workshops for nursing students of all ages. And I mean that from anywhere from straight out of high school going to college all the way up to adult learners, because it is never too late to start nursing school. There's no time limit. Okay, so if you needed to hear that today, here is your message. Be encouraged. There's no deadline. Okay. One other thing. Since I'm going to be teaching you heart failure today based on the Silver Bullet study system, if you want to learn more about the Silver Bullet study system, obviously you can learn it from my website, yournursingtutor.com, or in any of my paid programs, but you can also get a free 10-minute video that just gives you an overview of all 4 steps, what they are, how they work. You can get that by going to yournursingtutor.com/SBSS. That's SBSS, like Silver Bullet Study System, okay? So first of all today, so this is a little bit different. If you're watching this on a video, then obviously you can see what I have on my screen right now. If you are listening to this on the podcast, that is okay. You do not have to see my screen. I'm going to describe it to you, and I'm going to show you how to duplicate this for yourself when you are hands-free and available to study. Okay, but if you want to, you can always join my membership. This diagram is available for my members, or you can go to YouTube when this a podcast episode. I usually publish it to YouTube about like a week or so after it comes out on the podcast. So you can check it out there as well, depending when you're listening to this. But what I have on my screen right now, this is a diagram that I made for the heart to help me learn the normal cardiac anatomy and physiology. Why do I have this on the screen when we're studying heart failure? It's because it's like the crucial part of understanding heart failure. Okay. Everybody wants to jump into like, yeah, but what do I do about it? What are the symptoms? Just tell me what I need to know. I'm telling you what you need to know. Some people don't believe me. Okay. I had to argue with one of my one-on-one tutoring students the other night. She was one of my regulars too, but she's been having a hard time believing me when I tell her anatomy and physiology is the foundation to everything else that you learn in nursing school. And I'm going to show you why today. Because step 1 of the Silver Bullet study system is called Foundational 15. It's where you study about normal. And the question you ask yourself is, what do I need to know about normal before I begin to understand the topic I'm studying? So let's start with left-sided heart failure. Notice how I chose a specific topic. Okay, so left-sided heart failure. So when I'm thinking about left-sided heart failure, it should be pretty obvious. Like, you don't have to have any previous healthcare experience to know if I need to know about heart failure. I should probably know the normal anatomy and physiology of the heart. Okay, the normal anatomy and physiology of the heart. So again, if you're looking at my diagram, then you can see that the diagram I have is not a real heart. Okay, it's a heart. So if you're listening, I'm going to describe it to you. It's a heart like my 5-year-old would draw. Okay, you do not have to be an artist for this. It's just your typical what you would expect with 2 bumps on the top and a point at the bottom. What I found when I was in nursing school was that when I looked at a real anatomically correct heart picture, it drove me crazy. I could not understand it because it was all just mushy gushy, right? And there was like arteries and veins coming out of it, but they were coming out of it in a direction that just didn't make sense to my brain. So I always say, you got to find ways to study that make sense to your brain. So that's why I developed this, because I'm like, I just need to know conceptually. If I was going to be Miss Frizzle's substitute teacher, and if you don't know who Miss Frizzle is, you're missing out on the magic school bus. But if I was going to be Miss Frizzle's substitute teacher, well, I would need to be able to shrink down to microscopic size with a school bus full of 4th graders and take them on a guided tour through the heart. And so that's what I wanted to do, is I wanted a conceptual diagram that was going to help me memorize that in a way that made sense to my brain. And so the way it goes is that we start with the vena cava. So I'm going to go through the normal anatomy and physiology first, and then we'll move on to step 2, and I'll show you how that's going to help you predict the symptoms in step 3 and predict and understand the nursing care in step 4. Okay, but you have to know this normal first. So we start with the vena cava, and that is where all of the blood returns from the body. Now, one thing to point out, because this will be important later, wink, wink, nudge, nudge, keep this in mind for later when I ask you a question. But we think about when the blood is returning from the body, think about where is the blood immediately before it returns to the heart from the body. And it comes from 2 places, because it's, the heart's kind of in the middle of your body. So the blood's coming from the top down and from the bottom up. So from the top down, we're going to have like our jugular vein in our neck. That's going to be draining into the vena cava. And from the bottom up, the last major organ before the vena cava is going to be our liver. So we're going to have like all the blood from our liver then is draining into the vena cava. So that'll come back later. So pay attention. So anyway, the blood goes into the vena cava, which is a vein. Vena means vein, into the right atrium. From the right atrium, the blood goes through the tricuspid valve. It's called the tricuspid valve because if you ever look at a picture, and I would encourage you, use Google as a study tool, okay? Go to like the images tab, but say, what does the tricuspid valve look like? It's got like 3 flaps. Tri is the root word for 3. Tricycle has 3 wheels. Tricuspid has 3 flaps. So the blood goes through the tricuspid valve into the right ventricle. From the right ventricle, it goes through the pulmonary valve into the pulmonary artery. Now, this is the spot where I always stop and ask students, what is the definition of an artery? You got to think about this because I never ask trick questions unless I warn my students in advance. But this can feel like a trick question. Most people, because before nursing school, most people say, oh, arteries carry oxygenated blood, but that is not true, okay? Arteries are defined as carrying blood away from the heart. Carrying blood away from the heart. And almost always, arteries do carry oxygenated blood. However, the pulmonary artery is the one exception in the body of an artery that normally carries deoxygenated blood. And that is because it is leaving the right side of the heart. And remember, the right side of the heart has all of the blood returning from the body. So all the oxygen's already been sucked out by the tissues. We've got our blue blood, as the pictures show. So when we get to the pulmonary artery, it's deoxygenated blood, even though it is an artery, because it is leaving the right side of the heart. Now, where is it going that it's leaving the right side of the heart? It is leaving the right side of the heart to go through the lungs. And of course, this is where it gets its oxygen. Now, if you're doing respiratory disorders or anything, you definitely want to know about oxygen exchange. It happens, when the capillaries, so the pulmonary artery splits up into a bunch of capillaries. It covers all the alveoli. I'm not going to get into too much detail with that, but it's something you should know because it will come up with a lot of other disorders. But anyhow, it gets its oxygen from the alveoli, trades out the carbon dioxide, and now we have oxygenated blood returning to the heart, to the left side of the heart. And it returns through the pulmonary vein. So what is the definition of a vein? Hopefully you can figure it out because it's just the opposite of an artery. The definition of what makes a vein is any blood vessel that is returning blood to the heart. Now, in most cases in the body, of course, this means it's carrying deoxygenated blood because all the blood has been sucked out by the tissue and it's returning to the heart to get reoxygenated. However, the pulmonary vein, just like the pulmonary artery, is the one exception to that generality because the pulmonary vein is carrying blood that is freshly oxygenated from the lungs and it's returning it to the left side of the heart so that the left side of the heart can pump it out to the body, right? So the pulmonary vein is returning blood to the left atrium. From the left atrium, we're going through the mitral valve. Now, the mitral valve has 2 names, just to confuse you because, right, like you need more things to know in nursing school. The mitral valve is also called the bicuspid valve, so it can go by either name. And the bicuspid valve, bi means is the root word for 2, just like bicycle has 2 wheels. Bicuspid valve has 2 flaps. So remember, the tricuspid valve on the right side of the heart has 3 flaps. The bicuspid valve on the left side of the heart has 2 flaps. Now, I always used to get those mixed up when I was in nursing school. I never get them mixed up anymore. But when I first started trying to memorize that, I would often get it mixed up. So this is how you can remember that the bicuspid valve goes on the left side of the heart. The bicuspid valve, think about your biceps. Okay, you can't see me, but I'm curling my biceps right now. And bicuspid valve, right? So we have our biceps that we are curling. There's two because you're really, really strong. And when you're really, really strong, the left side of the heart is super strong. So it's pushing things all the way around the body because it's that strong. Okay, it's way stronger that it only needs 2 flaps. It doesn't need 3 flaps. Okay, so there you go. The bicuspid valve has to be stronger because it's, got a bigger job. The right side of the heart only has to push blood around through the lungs to the other side of the heart. That's not that far, But the left side of the heart has to push blood all the way around the body, so it's got to be stronger. So we've got our biceps to push it around. So anyway, we go through the bicuspid valve, otherwise known as the mitral valve, into the left ventricle. And then from the left ventricle, we go through the aortic valve. And from the aortic valve, we go out into the aorta. And the aorta is what then feeds the rest of the body, okay? So you have to have that memorized. And I don't just mean like, oh, great review, Nicole. Now I kind of know and I feel familiar with it. That's not good enough. Now you have to become Miss Frizzle's substitute teacher in order to be able to understand that. So, listen to this podcast a little bit. I just gave you that review and until you can repeat it back yourself. I encourage you to get a whiteboard. Feel free to again, if you're looking at this or my diagram screen or whatever, copy it for yourself when you're practicing and, or draw one yourself if you're just listening to the podcast. Okay. Don't be an artist. Just, it's a heart. And I divide the middle up into 4 sections, and I just put a little spot for a valve in the appropriate places between the atriums and the ventricles, okay? And then you label everything I just told you. Now, don't wait to have that memorized to start going on to steps 2, 3, and 4. But you do have to keep practicing it until you have it firmly memorized. Now, when we get to step 2, for left-sided heart failures of the silver bullet study system, step 2 is what has broken or changed. Now with left-sided heart failure, usually I summarize it because I want you to keep it in 1 sentence or less. Keep it super simple because it's just easier to understand that way. To be honest, we don't need to make ourselves sound smart. We just want to understand it. We want to be smart. Don't sound smart, be smart. So when you are talking about left-sided heart failure, I usually explain that as the left side of the heart is not able to pump blood like it should. Okay. Sometimes I'll say the left side of the heart has just gotten tired and giving up. There's 2, and then we go to step 2B. Step 2B is what caused that to break. And there's really 2 categories of things that can happen with that can cause the left side of the heart to be unable to pump blood effectively. One way, which is more of the slow chronic development of left-sided heart failure, is when the left ventricle has to work harder than it's supposed to for a long period of time. And it's most commonly caused by hypertension. So if you have high blood pressure for a long time, the left ventricle has to push really hard against that. I say it's let's say somebody stands by your front door, and is holding it shut. So every time you have to open your front door, you have to, do the normal amount of pressure to open your door, plus you have to push against the person who's pushing the door closed. You'd get pretty tired of that pretty quickly. And the left ventricle has to do that with every single beat when you have high blood pressure. So you can imagine for a while, it's going to do that. It's going to compensate because the body really tries to maintain homeostasis, but eventually it's going to give up. It's going to give up. And then, and this is what happens. But when it gives up with left-sided heart failure, like I said, one of the 2 reasons, the first reason is those cells, the cardiac muscle cells of the left ventricle, they get hypertrophied. That means they get, hyper means too much, trophy is in size. So they're growing in size. They're bigger than they should be. And that's not a good thing in this case, because the bigger they are, if they're too big, then that's basically shrinking the amount of space inside the ventricle for blood to be. So it can basically fit less blood inside the left side of the heart, which means that it can pump less out, because if you can fit less in, you're going to squeeze less out, right? So that's one of the step 2B causes that mean that the left ventricle is not able to push out blood effectively. The second cause is simply is more of the stereotypical, the left side of the left ventricle just is tired or dead or whatever. So like if some of the cardiac cells are no longer able to contract, sorry, I said that word weird. They're no longer able to contract. So why would this happen? Because if it can't contract, then it's not going to be able to squeeze either. And I say, like, picture me like opening and closing the fingers of my hand. Okay. Now that's pretty effective, right? But now let's say that 3 of my fingers can't bend anymore, and I'm only opening and closing 2 of my fingers. That's much less movement of my hand. And it's the same way with the left ventricle. So if some of the cardiac cells can no longer contract, we're going to be able to squeeze out less blood with each pump, or else it's going to take us longer to squeeze out the same amount of blood because it's just not able to work as hard. When might that happen? The most common reason would be myocardial infarction, which is a heart attack, because that's when the cardiac cells have died. And this would be a great example of a cause of left-sided heart failure that might happen overnight, okay? Or like overnight, I mean like happen very quickly in an acute setting, whereas hypertension would cause it to kind of gradually develop over time. So that's like step 2B. So you know, step 2B, I went into a little more depth with that just because I want to explain it to you and make sure you understand. But when you do it for yourself, you want to make sure that you're being very as clear and simple as possible. Try to categorize things, try to put patterns, look for patterns. If there's any risk factors, like a risk factor of developing left-sided heart failure would clearly be high blood pressure. Because just because you have high blood pressure doesn't mean you're going to develop left-sided heart failure, but it does increase the risk and the chances. So now we're going to move on to phase 2 of studying in the Silver Bullet study system, which is our step 3. Step 3 is where we stop memorizing and we start understanding. And you need to start by making some predictions. You can make predictions now based on what you know about the normal anatomy and physiology and what has broken. So we know the left ventricle is not pumping effectively. So what's going to happen? Well, just rely on the normal anatomy and physiology. If the left ventricle can't pump effectively, it can't do its job, what's going to happen? The blood is going to back up. It's going to be a bad traffic jam, okay? So the left ventricle, the blood is going to back up through the mitral valve, through the left atrium, through the pulmonary vein. So notice, we're just going backwards now. So this is why it's important that you have the cardiac anatomy and physiology memorized so that you can just think through this quickly. It goes back through the pulmonary vein and it backs up into the lungs. Okay. And this is why left-sided heart failure is characterized by respiratory symptoms. Okay. It's because the blood, the excess fluid in the blood is backing up into the lungs. So we're going to have those kind of problems. Now, that also means because we have more blood backing up into the lungs, we have more blood in the pulmonary vein, means we're going to have increased pulmonary pressures in the lungs and the pulmonary vein. So it's basically like high blood pressure, but it's specific to the pulmonary veins and the lungs, okay? Not necessarily systemic high blood pressure. But that can lead to water leaking out of the capillaries into the lungs. So it means you might end up with fluid in your alveoli now because the pressures are pushing the water, the blood, out of there. So you might have some dyspnea, which is difficulty breathing. Obviously, your oxygenation is not going to be super great anymore because it's harder for the left ventricle to get the oxygenated blood out around to the body. So you might be a little fatigued and things like that. Of course, like shortness of breath because you're having trouble with the oxygen exchange now. Because if the blood is moving, it's higher pressure, it's going to be moving slower through the lungs. And it's also, if it's leaking out, once you start getting fluid in the alveoli, that makes it harder for the oxygen and the carbon dioxide to diffuse in the opposite spaces where they need to go. And therefore, it can make it harder to oxygenate the blood. Okay. You can also see things like pink frothy sputum. And now you know why, okay? Because you have this blood backing up in those pulmonary capillaries, spilling out into the alveoli. You can have some pulmonary edema and things like that, okay? Now you know the symptoms of left-sided heart failure, and you're not going to confuse it with symptoms of something else. But let's take it a step further, because now this is where I really give people light bulb moments usually. This is where you're like, oh, wow, yeah, cool. So now you back up, you keep backing up, right? Because it's a traffic jam. And left-sided heart failure is not going away. It's chronic. We can't fix it. We can only manage the symptoms. So it backs up into the pulmonary artery. And when we get to the pulmonary artery, again, that's going to increase the pressure in the pulmonary arteries. And now, look at this. What backs up before that is the pulmonary valve and then the right ventricle. And now the right ventricle has to push harder. Because remember, the right ventricle is kind of lazy. It only has to push blood through the heart and back to through the lungs and back to the other side of the heart. It's not used to working as hard as the left ventricle, but now it has to because the pulmonary pressures have increased. So now the right ventricle has to push harder to get the blood through that traffic jam that's been caused by left-sided heart failure to the left side of the heart. Guess what's going to happen to the right side of the heart eventually? If you said it's going to get tired and fail, you are correct, because now we have the same possibility of breakage that was one of the big causes of left-sided heart failure. And that is why one of the primary causes of right-sided heart failure is left-sided heart failure. So right-sided heart failure is a very real potential complication of left-sided heart failure, and this is why. Because you have this backup over time. It's pushing against higher pressures over time. Eventually, the right ventricle is going to get tired. The cardiac muscle cells are going to get hypertrophied and get too large, and you're going to lose space inside the right ventricle to push blood, and it's going to push less blood out. And now you have right-sided heart failure caused by the left-sided heart failure. Now, you can also develop right-sided heart failure with a myocardial infarction, same as with left-sided heart failure. Okay, so that's another possible cause. But you can see now that once you have left-sided heart failure, you can understand why right-sided heart failure is a potential complication. It's because of that traffic jam. So let's go ahead, let's go wild and crazy, and let's predict the symptoms now of right-sided heart failure too while we're talking about it. So the symptoms of right-sided heart failure are going to just have to do with the traffic jam backup. They're going to back up through the tricuspid valve into the right atrium and back out of the vena cava and into the body. So now with right-sided heart failure, we have symptoms backing up into the body. They're backing up into the body. And do you remember at the beginning of the podcast episode, I pointed out, where is the blood coming from immediately before draining in the vena cava? Because guess what? Those are going to be your first symptoms. So if the blood is draining from your jugular vein, you're going to have a bulging jugular vein, right? Distended jugular vein, because it's a traffic jam. There's too much blood in there. What else? What about your liver? You're going to have too much blood backing up into your liver. This can cause things like portal hypertension, which is basically like what we're talking about pulmonary hypertension. This is hypertension specifically in the vessels that travel through the liver. Now, what is the liver supposed to do? Normal anatomy and physiology. So you can go back to step 1 and add this in if you don't know this already. This is how, by the way, this is an example of how the silver bullet study system is a self-correcting study process. Because even if you miss something important from step 1, you will notice it when you get to step 3 and 4 if you're not able to connect things to previous steps. So in step 3, now that we're in step 3, we say, well, what's the job of the liver? Well, it's to, metabolize things in the blood and to help filter and clean the blood. So if the liver is all backed up, it's not going to be able to do its job as well, right? So we're going to have potentially some symptoms related to not being able to cleanse the blood like the liver normally should do. It can also cause some damage to the liver because of just like high blood pressure always can, right? And so over time, this wouldn't be an immediate symptom of right-sided heart failure, but a late stage symptom would be liver damage, maybe cirrhosis, scarring of the liver, things like that, okay? Also, right-sided heart failure is more of where you're going to see the edema in the body, like a body edema. Because remember, the right side of the heart, the traffic jam is happening in the body. So we're going to get the blood and fluid getting backed up in the body. So we might see edema. Now, guess what else? As we're getting fluid increasing and backed up in the body, it's also risks increasing blood pressures. And guess what? One of the possible causes of left-sided heart failure was, remember, chronic increased blood pressure. So now by the time we're getting into the right-sided heart failure symptoms, it's come full circle. And it becomes this like negative feedback cycle, because high blood pressure makes the left ventricle harder to work, which leads to left-sided heart failure, which then makes it harder for the right side of the heart to work, which leads to right-sided heart failure, which then backs up into the body, increasing the blood pressure further, which makes it even harder for the left side of the heart to work. So you can see now why heart failure is not like something curable. It's something that is going to just get worse with time, which is why we need to manage the symptoms. So does that make sense to you? I would love to hear what you guys think. Wherever you're watching this, tell me what you think. Do you understand the symptoms of heart failure now? And can you see the importance of understanding anatomy and physiology, and how knowing normal, even though you're not specifically tested about normal on your exam, is going to make your studying so much easier. So much easier, y'all. Okay? Now let's get to step 4. Step 4 is finally nursing actions. So what do you do for this? You want to predict what nursing actions to take. Okay? So we predict which nursing actions to take. And this is going to look like, usually I tie it back to things we see in step 3, and then I do a section tying it back to things we see in step 2, and then we tie it back to things we see in step 1. So let's start with step 3. We're going to look at the symptoms, right? So let's start with left-sided heart failure. Remember, it's mostly respiratory symptoms. So we're going to expect to do nursing care, medical care that is going to help promote your respiratory system, make it easier for you to breathe. So that might involve providing oxygen, administering oxygen, right? And if you don't remember how to administer oxygen from your first semester fundamentals class, then you go back to step 1 and you backfill that knowledge, and you say, okay, I need to review the normal oxygen administration criteria and the masks and things like that. So then you go back to step 4 and you come up with your next intervention. But now you know why you do the things. Like, you're probably going to want somebody like this to sleep in a semi-Fowler's position instead of flat on their back. This is why they often sleep more comfortably in a lazy boy chair, like an armchair at night, instead of in bed. Because it helps to give their chest more room to breathe. We might expect that their pulse ox might drop a little bit. We might expect them to get easily fatigued. Okay, so these are things, I say the pulse ox dropping because guess what? We should be measuring their pulse ox. We should be counting their respirations. We should be taking their blood pressure. These are obvious things that are like, well, yeah, nurses do that, but you don't always think about it with heart failure. But now we know why we would do that. We would also expect a patient with left-sided heart failure to possibly, because not everybody will be, but possibly be on a blood pressure medication to keep their blood pressures down, because that may have been what caused their left-sided heart failure in the first place. They might also be on a diuretic, because that is going to just kind of help take the pressure off the heart, so there's less blood altogether. Less fluid altogether for the heart to pump. But again, that's going to also help with right-sided heart failure, isn't it? Because, it's going to help get edema down, and it's going to make it easier for the right side of the heart. So we could see those kind of medications being used for either type of heart failure. When we're doing with right-sided heart failure, again, we're going to look for those body symptoms. So we would definitely expect a diuretic with right-sided heart failure to help get some of that excess fluid that's backing up out of the body, so on. Okay, so these are the kinds of things you do for step 3. Now, you can look back at step 2. In step 2, you say, well, is there anything we could do to fix or reverse the root cause? In this case, not really. Okay, because like we said, can't fix heart failure. So there isn't always something. Now, if it was something like an infection, like if it was pneumonia and bacterial pneumonia, then yeah, we give them an antibiotic. And that would be an example of how you would fix or change the root cause in step 2. But there's nothing really there for heart failure, so we would just go by that. And then we go back to step 1 and say, is there anything we could have done to prevent this? Are there any risk factors? Is there any patient education that needs to be done? And so then you can think it through. Like, if they're likely to be on oxygen, we can give some patient education on how to use oxygen, no smoking, things like this. If it's if we're thinking about ways to prevent it, we're going to be thinking about blood pressure medications, lifestyle changes that might reduce the risk of heart attack or things of that nature. And now here's the beautiful thing is because now when you get to your test, when you understand heart failure this way versus simply just trying to memorize a list of symptoms for each side, left and right sided heart failure, which you're probably going to mix up because you don't really understand why they happen for each of them and not the other. And what nursing care you would do differently or prioritize differently for the both types of heart failures. Now you are going to be able to to logically think through any kind of scenario related to heart failure that they give you on the exam, which means that even if they test you on something you have never before studied, it will not matter because you have the framework you need to think it through and come up with a really good educated guess, which maximizes the chances that you're going to get the question correct. Because again, you've heard me say this before if you're a regular listener to this podcast, but I do not want to get you 100% in school, okay? I want you to get good enough grades that you're solidly passing and can keep a well-balanced life and you're not stressing yourself, given that you are learning how to think like a nurse. As long as you're learning to think like a nurse and you're passing comfortably, that's what I want for you, okay? Because that leads to a better life. So now that you understand the connections, you can think through different scenarios and you can evaluate, I've never heard of this nursing intervention. But let me see, would this nursing intervention, would it address one of the symptoms? How would it address the symptoms if so? Would it address a root cause? Would it be something that would prevent it? And if the answer to one of those questions is yes, then it's probably the correct answer, even if you didn't specifically memorize it from your textbook. And so now you no longer have to second guess yourself and be like, well, I think that's right, but I don't know why, so I'm going to change my answer, because now you will know why, even though you didn't specifically memorize that. So I hope this was helpful to you with heart failure. I love teaching on heart failure. I love teaching on all this stuff, guys. Myocardial infarction and stroke. I did tuberculosis today with a one-on-one tutoring student. We went together and created our own silver bullet study system in our one-on-one tutoring session for him to study. If you want help with me, if you want to work with me, I would love to work with you. Just come to my website at yournursingtutor.com, go to /products, and you can see all of the options for working with me. If you just want to learn more about the silver bullet study system, you can get a free 10-minute overview video at yournursingtutor.com /SBSS. Now, one more thing before you go today. If you got a chance, if you got anything valuable out of today's podcast, I would really appreciate it if you could go to Apple Podcasts, look up the Navigating Nursing School with Your Nursing Tutor podcast episode, and give me a 5-star rating and a review. It really, really helps other nursing students to get the kind of positive and encouragement that they need to thrive in nursing school, and it helps them to find it as well, okay? So until next time, good luck on your nursing school journey.